Hello and welcome to Helen's Place. I want to thank all of my new subscribers over here on Helen's Place and also over on Helen's Ministry on Facebook. My new followers over there. As you know, we started 2020 out with health and wellness, and we're going to continue that today. I had many topics that I wanted to talk about, but today, early this morning, it dawned on me to talk about mothers-to-be and some of the health issues that moms endure when they are pregnant and not living a healthy style before they become pregnant. So one of the things I really want to point out about living a healthy lifestyle is that your weight is very important, especially if you're going to have a baby. If you're planning to have a baby, it plays a big part in how healthy your pregnancy will be, how healthy your baby will be. There are a lot of issues that transpire during the months that you're carrying the child, and some of the things that you do before and during will have a big impact on the birthing of the child. So weight is one. And as you know, our weight can affect our blood pressure. It can affect our glucose. So we have some mothers who go in with weight issues that run into preeclampsia, gestational diabetes, and all of these I've experienced. So I'm telling you, not just from a licensed nurse, but also as someone who experienced all of this. So what you want to do is keep your weight under control. Sugar, eating healthy, having this healthy lifestyle that I talked about in the beginning is important for females as well as males, but more important for us because we are the chosen vessels to birth and these gifts that God has given us to bring onto this earth. So we want to especially prepare ourselves for birthing these babies into the world. So you want to not overeat. Some people think you're eating for two. No, you eat healthy. And you continue to be active. That's important also. That will help you to not put on all the pounds during your pregnancy. Some people have already started to have some unhealthy types of habits that if you are going to plan a pregnancy or even just as females, we should not be smoking. We all have these things that we go through in life where we experiment with smoking. Okay, let's get past that. We did that when we were teenagers. Let's let it go. Let's just find another way of coping. And there are other ways of coping. I can talk about that later, but today I want to talk about making sure that we have healthier births, healthier deliveries for the sake of the newborns. And also that once you start your pregnancy unhealthy, you will most likely have some health issues with birth. A lot of times if a woman is preeclampsia, they will induce the labor, which to me is 10 times or 100 times harder than just a natural birth and carrying your baby full term. All of the issues that you deal with are very hard, and I won't say this is across the board because it also depends on your hospital that you choose. So you want to check out the hospitals. You want to talk to people who have given birth, or look at some views on those particular hospitals because induced labor is very painful. And if you don't get the proper epidural or pain meds, it's very hard on the mothers. So you want to be careful with that. And most of the times they will have to induce your labor because of preeclampsia or some other type of problems that you may be experiencing for you or danger for the unborn child. So as females, we want to be health conscious people. We want to have healthy lifestyles. In the case that it doesn't work out that way for you, and you haven't let go of some of your habits, smoking, drinking, not getting proper rest. You want to try to work with hospitals, doctors who will know how to handle the complications that you may endure in your pregnancy. Now, I've talked about the induced pregnancies, and most of the time, if they induce a month before, or 5 weeks before, some babies come even before then. Most of the time, they're preemies. And I saw some very small preemies in the NICU, which is the newborn intensive care unit. So 1 pounders, 2 pounders, 3 pounders. So we want to be careful, and then our babies have to stay in the NICU for months until their birth weight is up and they're eating and doing all the things that they would do at full term. So moms, we play a big part in how healthy our babies come. Sometimes we can't avoid early deliveries, but the things that we can do to prevent them, we want to be mindful of them, so that they can have a healthy start. Now, I talked about the induced labors. I want to talk about also C-sections. C-sections are come about, they do them because of a lot of reasons. The babies, years ago when I had my first C-section, it was because my child was breech. Now, I don't know if they do that so much today, but my child was breech. Her shoulders were too large to turn, and because of that, I had to have a second C-section. Now, what I can tell you about C-sections is that it felt as though I'd had the baby naturally, because the things that you endure during a natural birth, as far as after the surgery is over, because it is surgery. You're being cut open to take the baby out. So, if at all possible, some things you cannot help, as far as my daughter would not turn, that's, you have to go through the process. Now they have doctors who will try to turn the babies. It's very risky. I don't know many who would do it, but some people have said that they turned the baby, or some people have said that they delivered a breech baby. So, but anyway, from my experience with C-sections, they're not a cup of tea. They're just, and that's not the word I want to use for it, but they're the same experiences to me as you have. The experience with the natural birth, I should say, is the best birth. That's what I wanted to get across to you all. And also prevention, healthy lifestyle prevention. Now, I want to talk about what we can do after we give birth, and it's so important to how well our bodies heal. Now, for me, when I had a natural birth delivery, you can come around out of that natural birth maybe the next day. Sometimes we don't feel like it, but if you feel like it and you want to start your Kegel exercises maybe within 10 to 12 or 24 hours, because I did, the very next day I was doing my Kegel exercises. And don't let me forget to tell you about breastfeeding, the benefits of breastfeeding. If you have a preemie, breastfeeding is the best milk you can give them, the best milk that they will tolerate. It is liquid gold for your babies. Not just preemies, but for babies, because it's going to cut down on the amount of colds, infections, ear infections, all the way across the board, because you are giving them that immunity that they need from your breast milk. Some people talk about how painful it is, but after a while, you kind of, if you do it the right way, you won't get the sore nipples. It's about technique. So now they have these really, these coaches, these breast coaches, these people that come in and teach you how to have your baby to latch on, how many minutes you can breastfeed to keep your nipples from getting sore. The best advice I can give to you is to make sure they're latched on properly, so that you won't have those problems. Not just breastfeeding, just not for the breast milk, but also for your uterus. It makes your uterus contract so that there's less bleeding. It also helps your uterus to go back to the shape that it was, so that we don't have these big protruding stomachs after giving birth. It is wonderful. Although a lot of people cannot breastfeed, they don't reap those benefits. If you cannot breastfeed, then you want what I did with my children, but I breastfed with all of mine, I can say. You want to start your exercises, the Kegel exercises, if you can tolerate them. And then once you get home, you can continue to be active as much as your body will allow you to, and your baby. But not only that, once your baby can hold up their head, you can do little exercises with your baby. Because we, as females, after we give birth, we want to get our bodies back in shape. Yes, being a mother does not mean that you let yourself go. That's just my opinion, okay? Some people may say they're too tired to worry about their bodies. They have to take care. Yeah, you take care of the children and you take care of your body, because it is going to make the difference in your life for the long haul of your life and how healthy you are as you age. So we have talked about some very important things, because it's important for us to live a healthy lifestyle, because we are mothers. We do give birth, and we want to have healthy births. We want our children to have these healthy lifestyles so that we don't have so many issues when they're born. And I just want to share that with you. I had many things that I wanted to bring to you, but since I just had an experience this month with a preemie, not mine, but it was a very traumatic birth, and so I wanted to bring that awareness to young women and women who are of childbearing. I don't want to say childbearing age. They always put that stigma on us, childbearing age. But childbearing is for women of all age. And the doctors won't tell you that, because, we don't take care of ourselves, and they don't want to deal with these unhealthy babies and unhealthy mothers who are not prepared to give a healthy birth. So we want to take care of ourselves. As you see, women are giving birth into their 40s, in other countries in their 50s and 60s. So it's all about your lifestyle, your healthy lifestyle. And when we live a healthy lifestyle, we pass that on to our children from birth. So I just want to bring that to you all. Let's think about those newborns before we birth them out, as we carry them, to be careful to what we're doing as we're carrying them. Stop smoking, or don't smoke if you are a mother or childbearing age. And you want to plan to have children someday, because when you find out that you're pregnant, it may not be as easy as you would have thought it is to stop smoking. And one thing I wanted to recommend to the mothers who do smoke and can't stop, try the patch. Put the nicotine patch on. The patch will not only help you stop smoking and take away the cravings, it will also help you later on after you give birth and you want to do breastfeeding. So it is important, because if you're smoking your breast milk, you have to wait 2 or 3 hours before you can nurse after smoking. So you have to ask your nurses, you have to ask the doctor to give you a nicotine patch during your pregnancy, or if you end up in labor and delivery, ask them at that time to give you that nicotine patch. It's going to make things a lot easier on you trying to go through birth, and you're craving a cigarette and you're having contractions. Is something you don't want to deal with. So I just want to pass all that on to you. And as you know, a lot of us are grieving, or we're experiencing the grief from all the feeds going through on social media about the Kobe Bryant and his family and the people that were on board that helicopter. I plan to come back later with something about all of this. But right now, I just want to continue with living a healthy lifestyle and continue on our health and wellness for 2020. I love you all. May God turn his face to shine upon you, and may God bless you and keep you until we meet again. Bye-bye. I love you all. Bye-bye. Bye.